Wonderful. So we are live. So thank you very much, everyone, for joining the second meeting of the Longevity Ready Maryland Stakeholder Advisory Group. My name's Liz Woodward. On behalf of the Maryland Department of Aging, I welcome you and I thank you for being here this evening. I'm going to go ahead and show my screen and talk through the agenda for today. All right, so here's our agenda where we kind of already accomplished our brief housekeeping to get us set up for our recording. I want to start with introduction of new members, some folks that weren't on last time, and then we'll do a review of our key aims for why we're here today. Then we're going to get into reporting out from our first meetings, discussing how we want to manage some of the information that came out of those meetings, and then really planning for the next work group. All right. So let's start with introduction. So anyone who was not on our meeting last time, please, we're hoping you'll introduce yourself to us by sharing your name and briefly telling us about the unique perspective that you're bringing to the table in these meetings. So for example, my name is Liz. I've been at the Department of Aging for several years, and I bring a lot of knowledge about existing state and local agency initiatives. So if you weren't on the meeting last time, raise your hand or go ahead and take yourself off mute and introduce yourself. Tiffany, go ahead.
I'm Tiffany Nicolette. I'm the Vice President of Housing and Services for HI. And the unique perspective that I bring is, so I've been in the affordable senior housing industry for 15 years or so. And also working on the supportive services side. So I have a nice combination of both, and always with those with like lower income.
Thank you. Dan, go ahead.
Hi, everybody. My name is Dan Martin. I am the Senior Director of Public Policy at the Mental Health Association of Maryland, MHAMD. It's a nonprofit education and advocacy organization concerned with all aspects of mental health and substance use issues, and we chair a number of coalitions. One of the coalitions that we've shared for several decades now is the Mental Health and Aging Coalition, which brings together representatives from different advocacy organizations, government institutions, and also provider organizations and elsewhere, all working to kind of address the unique mental health and substance use needs of older Marylanders. And so I've been doing this work. I've been with the Mental Health Association for 14 years. Been engaged with the Aging Coalition for that time, and look forward to kind of bringing that perspective to this group. And thanks for being happy to be here. Thanks.
Thank you. Anybody else who wasn't on our last meeting that wants to introduce themselves? Okay, we were all here. Fantastic. All right. So before we dive in to our meeting content, I wanted to review the aims of the Longevity Ready Maryland Initiative while we're all here today. So collectively, it is our job to bring greater attention to the opportunities of an aging society and begin to transform the complex systems that result in a growing population of older people who lack health, financial security, social connection, and purpose. So you may remember from our first meeting, that's sort of the vision, is to have a society where we are achieving those things for all members of our society. So our job here at the Stakeholder Advisory Group is to reflect collectively on how we can best get to where we need to be for the measures of success we have identified. And I'm just going to pull up, as a reminder that we have this document. This is part of our work group packet that really identifies what we're trying to do here. And you can see we kind of specify our measures of success. So we'll be successful if we establish specific, measurable, achievable, realistic, time-bound, inclusive, and equitable objectives that include short, midterm, and long-term strategies. We'll be successful if our work group recommendations adopt inclusive approaches and innovative strategies to address the evolving needs and that embrace the contributions of older adults, emphasizing value of the diverse perspective and acknowledging the impact of health disparities. We'll be successful if our recommendations promote access, equity, and choice. and will be successful if our recommendations build upon, enhance, or refine existing strategic plans, services, community resources, and policies. So again, our job here is to reflect on that collectively and allow us to develop these actionable state-level solutions that are going to start the system change we need. So I want to remind us too of this slide that we took a look at, thinking about the levels of advocacy and where we really want to be with our recommendations through our work groups, which is here in this public policy level. So we want to remember that this plan is a starting point, right? It's not the ending point. It's not where we stop the discussion. And we also know it's not going to solve all of Maryland's challenges, which are extremely complex. We were just speaking recently as a group about affordable housing and how many different aspects go into this one little section that is not a little section, but is one piece of a very large plan that we're trying to build. And there are many ways that we can go about addressing that within our state. So we're going to review our template at the end of this meeting in preparation for the second meeting. But right now, let's go ahead and shift into the next part of our agenda, which is reporting out from our work groups. So the first on my list is the Longevity Ecosystems work group, and I'm going to pass it over to our chair, Pazit Aviv.
Thank you, Liz. We had a first meeting last week, I think a little over a week ago. It was extremely robust and energizing for all of us. I think people had sort of ended the conversation saying, thank you. This conversation itself was really amazing because it was sort of a far-ranging, multi-sectoral approach to what does that mean to be a part of our work group, what our goals would be and how we're going to work on it. We outlined the recommendations that the resource bracket mentioned, but also expanded it to solicit input from members about what they think we should focus on so that we are not missing any kind of important priorities. And we had shared a survey. Thank you, Chelsea. It's working. A survey where we vote on 4 priorities so that we can then divide ourselves into the sub-work group, and then people will select themselves into one of those subgroups to focus on the priorities. I can read you the list of topics we had discussed. The first one was engaging grassroots hyperlocal models of community building. The second was increasing volunteerism and community engagement to make Maryland a state that serves. The third is adopting the age-friendly communities model and practices. The fourth was facilitating relationship building and interaction between people across the lifespan. The next one was addressing safety, security, and emergency preparedness. The next one is promoting digital literacy and access. And the one before last is embedding equity and inclusion in state system to eliminate disparities across the lifespan. And the last one is supporting local government organization and leaders through targeted resources, collaborative service model. So that was kind of a mouthful, but I just want to give you the scope of the breadth and scope of what we had discussed. And I hope we pick good 4 and forge ahead.
Wonderful. Thank you, Pazit. Next on our list is the Promoting Economic Opportunities group.
Thanks. Hey, Liz. Thanks for sending it over here. So we had our meeting last week too. Again, a great word. It was very robust. We had about 20 some members. Promoting economics, just as kind of a reminder, is so we're focusing on family caregivers and how that works within, I'm going to say workforce, but it's also housing. This is where it cross sectors, right? Keeping people in their homes. We have direct care workers, which has been an issue for a long time and a lot of things going on. So we have a direct caregiver workforce group, and how do we address the issues around that? We need plenty of healthcare workers. We also have workforce group with 50 plus and multi-generational grandparents that have to work but yet take care of either a grandchild, or you've got the old word sandwich generation. So that's what our group is working on. After we got to know each other, we have divided up into 3 subgroups. Our family caregiver, we are very blessed that our lead, Teresa Robertson, who is in the SAG group, is with the Maryland Commission on Caregiving. And so we are utilizing that group of expertise as our subgroup. And they will be hosting 2 meetings as well as breakout groups within our group, and to talk about some of the big topics we have to talk about. Our direct caregiver group, that is a subgroup. They've already been meeting a little bit, and so they have a couple of initiatives going on with a lot of work with the Department of Labor, a lot of the cross collaboration there. And then our new subgroup that came out of our meeting last week is the 50 plus, getting 50 plus and our older Marylanders back into the workforce. We need them, they need to work. And so we have a lot of people from CSEP and Department of Labor that have created their own subgroup, and they will meet probably 3 times as well as our subgroup. So everyone kind of has decided where they want to go. And so now we've come up with the big challenge of, what's the one epic goal that we want to accomplish, and then what are all our strategies under that as to get it accomplished to pass off to this report. Our next meeting is tomorrow, and then our subgroups meet kind of on the off week, and then we come back as a big group and meet the next week, and kind of how it goes on down there. Yes, thank you. I'm becoming a real person with these acronyms, right? I can actually say them now. And if y'all knew me 7 months ago, I didn't know what any of this was. So this is big stuff for me. So yeah, we had a really good group, and we're off to running. And so it's a lot of fun, very energized, and a lot of emails after. And I do like seeing that. So I'm just a thrill, This group is really a great group. So glad to be a part of it. And look forward to reporting back to this group in 2 weeks on kind of the things we come up with tomorrow.
Thanks, Leslie. And we didn't introduce you, but Leslie Ray is our Director of Client and Community Services at the Department of Aging, and supporting our chair of this group. And for those listening in, CSEP is Senior Community Services Employment Program. Next up is the Affording Longevity Group. Who are we passing it over to?
Sure. I can start us off, and then Izzy, if you want to chime in with anything. So similar to what the other groups did, we spent the first part of it, really the first part of our first meeting, really getting to know each other, learning a little bit about, what folks are bringing to the table, and then having our, I guess, priority areas within our priority area of affording longevity. And so they are affordable housing, affordable healthcare, accessing long-term services and supports, and then also financial security. And our plan is basically to, as we meet with subgroups, kind of provide some information for folks to chew on in between those subgroup meetings. We're going to meet as a large work group and then do breakout sessions during that meeting, where each subgroup will have their prompts and be talking through different solutions, and then we'll reconvene as one central work group to kind of talk about what the subgroups discussed, to see how everything fits together and making sure that we're not duplicating efforts. And Izzy, I don't know if you have anything else to add.
That kind of sums it up. Our first meeting, we really spent, besides talking about organizing around those 4 priority areas, just trying to identify some of Maryland's strengths and opportunities. So as a group, we listed out some things that we thought makes Maryland unique in this discussion. As we look at the other states, multi-sector plans, we try to tease out what are some of the things that may cause us to raise some things up, or de-emphasize other things based on, our reality here in the state.
Wonderful, thank you. And finally, the optimizing health, wellness, and mobility.
I'm not sure if Rhea is on or not, but I can chime in if that would help. So our group is, as Liz had mentioned, is optimizing health, wellness, and mobility. We, like the other groups, spent some time getting to know each other and getting to get an idea of what each other's skill sets were, so that we could have a good feel for the varied expertise in the room. Our recommended priority areas were person-centered care, transportation infrastructure, brain and physical health, and social connections and sense of purpose. We have polled our members of our group to see which areas we asked first and second priority, which areas they would like to be working on, just so that we can make sure that our subgroups are populated in a more balanced way. I think we're going to be a little heavy on some and others, so we did ask for 2 choices because we want to make sure that there's enough folks per work group. We are also looking at what other states are doing in terms of policy and practice to see what works and what doesn't work. And we're looking forward to our next meeting where we'll break out into groups and have those more formalized discussions. I'm sorry, Ray, I didn't see you there. Is there anything I'm missing?
That is perfect. That is perfect. I think it was really important just to get to know each other, and because it's just so comprehensive and cohesive. I think so. One question that came up: why age 50? And so I got a chance to talk about, it's the 10-year plan. And also because of the accelerated aging. I mean, in certain areas in Maryland with person-centered care and chronic illness, some subpopulation would have accelerated aging at age 50. So it was just wonderful to start. And I think Mark talked about everything. We talked about the comprehensive plan that transcends traditional state efforts focused solely on elderly care and adopts a holistic multi-sector approach that promises transformative impact on people we work with and we work for, including health, financial, social, connectivity, purposeful living, and what's important is that it's equitable, so it's irrespective of the socioeconomic state.
Wonderful, thank you. Anybody else who's part of this group? Of course, everyone who's here is on a work group. That's how we've organized this. Does anybody want to add anything, highlight anything from your work group discussion that you think really should be reflected upon within this space? This is open forum to do that. Yes, please go ahead, Stephanie.
Yeah, excuse me. I just wanted to talk a little bit about making sure that there's an eye to not leaving behind people who are homebound. And so lots of great ideas that are happening in terms of transportation and economic opportunity and things like that. But there is a large population of people who, if we don't look at how we bring services to them, will be left behind in no services. So that was something that came up in our work group, and I wanted to make sure that that I addressed that. And just, as an example, if we're talking about economic opportunity, there could also be an eye to economic security. And I think Tiffany mentioned financial security, and that's not just by putting somebody to work. There are lots of ways to achieve economic security, and most specifically for those who aren't going to be able to go back to work or to do any kind of, CSEP type of program, would be to make sure that they are accessing all of the resources that they have available to them. So that's just an example and part of a conversation, a brief conversation that we had in our work group.
That's a great comment, Stephanie. So I'm definitely going to write all that down. It fits in a lot of mine. Excellent comment. Thank you.
Pazit, go ahead.
Conversation, as I had reported previously to the group ahead of time, touched on a very wide range of priorities and topics, and just wanted to acknowledge the fact that there is no possible way we can be all inclusive, that it is okay to state somewhere in a little disclaimer that we are prioritizing what we think is important. It doesn't mean that it is to the exclusion of other topics. We're just, like you said, Liz, we're starting somewhere, and that maybe there's a place to note some of the other priorities that didn't make the cut simply because of our need to focus, but have some continuation afterwards.
Yes, thank you. I think that's important. I think it's really easy for us to want to talk about everything all at once, and we know that we can't do that. We're going to have to prioritize, and I think in some ways this group is a good forum to think about how to do so effectively. Allison, go ahead. Oh, sorry, go ahead.
No, I'm sorry, Liz. I think so too. Just off of that, you know, of those of us that are leading some of these, if anybody on this call is in a subgroup or in a work group, I think it's going to be a constant thing, because that we're constantly kind of saying what the main goal is and the strategy. And so anytime you might see a group get off kilter, if anybody can help get them back on kilter to what's the difference between a strategy and not. We have a short amount of time and not a long time to get there, right? There's a song in that somewhere. It's after 6 o'clock, so I'm thinking of a song. But anytime we can use our resources as this group SAG to help keep people on the right thing, we get to the end quicker, right? And strategies are actually what's going to keep this plan, in my mind, walking for 10 years. The big one is where we got to get to. So I think we've talked a lot about it internally within MDOA, but anybody on this group who can help, if you see it get off, get them back on that. This is a strategy, and is this a real important strategy, or is it a 2-year strategy or a 4-year strategy? Helps people maybe back off trying to get everything done at once.
Allison, go ahead.
Sorry, I was having some technical difficulties. I was just trying to pull up because I wanted to note the exact language. But Liz, at the very beginning of the call, you noted kind of how we'll know we're successful in this work. And one of those statements was around being connected to existing strategic plans and initiatives. And I'm just wondering, how are we kind of cataloging that? So, for example, the department, DHCD is doing their kind of state housing assessment work right now. And I'm sure there's other departments within state government that might have similar things. How are we kind of mapping and coordinating and cataloging what's already happening so that we know what we can really take advantage of?
Yeah, that's a great question. I mean, I think that's why we started with this work group packet, because we have many of the elements in there. And as you say, that DHC is a great example. We've got a plan that we've included from the previous administration that has specific recommendations we can build upon. But there's an effort going on right now that isn't sort of already produced for us to rely on. So we're excited that we do have members of DHCD that are part of this process, and I would say relying on them to identify that, what's already going on, and relying on us state staff. So if folks are saying, well, this wasn't included in the packet, I think there's something going on here, that's a way that you can kind of poke us over at the Department of Aging to say, is there something here? And if not, maybe that's a strategy that the state needs to employ, right? Maybe it's about including older adults in a housing or a workforce strategy as a target population, and what do we need to put language wise into this plan to move us in that direction. So I think in some ways we have a starting point. In some ways you guys are bringing that to the table, and I think it's also an exercise that needs to be a focus moving forward in our implementation stage as well. Another good example is health equity plan, right? There's a big effort at the Department of Health and an existing work group like this, you know, that's putting together a health equity plan. We've included the assessment data within our packet, but the plan itself is still in development. So in some ways, what we want to make sure that we're doing is saying there's a plan that we should be building upon. We don't have the information on what the plan is, but how do our strategies point to incorporation and focus of an older Maryland population as part of those existing strategies that are being developed, which may or may not be happening now. Sean, go ahead.
Hi, yeah. I guess one of those types of things would be the Maryland Time to Care Act, which is also known as the Family and Medical Leave Insurance Program, which is this new, hasn't kicked off yet, but state-funded program to provide paid leave to eligible employees. I just think we're going to need to have some folks who are involved in the evolution of that program. But the other thing I wanted to mention is that in the age-friendly network in Montgomery County, there were a number of people who were hoping to participate in this process. And at one point, people had said that maybe some of these subcommittees that each of the work groups form would be an opportunity for people to participate. I don't know if that's realistic or people can say yet whether they think they could extend invitation to people. So for example, like when you mentioned the new group looking at employment, there is an age-friendly employment group in Montgomery County, very active. Some of those folks might be interested in lending a hand to this discussion that that particular committee has on 50+ employment. So is there a way, can we talk process-wise, a way to extend invitations to people to participate in some of those conversations?
Well, I will say, Sean, that's a great example where we do have a Montgomery County expert in that area who's also part of the Age Friendly Institute that is lending her expertise to that group specifically. So we're excited about that. And I do know that a couple of our groups have already kind of reviewed those lists and brought people into the conversation that were not originally placed on a work group because we can't have everybody in the room at the same time. So I would say that's a really great example of how we can utilize the existing resources of people who said, yes, I want to be part of this. We did inform anyone who wasn't selected as part of the process that, you know, we might call on them for subcommittees. And we also hope they will be participating in these meetings and joining our public comment. So anyone who's thinking, well, we're kind of missing some expertise or we need some additional folks in the room, that's a great starting point. And we can also organize to invite guests that have specific expertise that we might think that we're missing or to inform us of existing work that's going on. And that's something that your staff that are part of that can kind of help initiate, that are part of your work group can help initiate. And we've heard from those folks in this meeting, and we've got, you know, additional support staff here at the Department of Aging. We can kind of help with that. And again, one of the things we can say is, you know, from our research, that's not happening. And maybe that then becomes a strategy within our plan. Right. Data collection efforts, for example, were a big focus of our longevity ecosystems group. Like what don't we know, right? All right. Anything else? Any other comments, things that came up in your meeting? Go ahead, Raya.
You know, I'm just thinking, you know, with what Sean is saying on age friendly, because that's really like in my group, there's the holistic care. And, you know, the first item in age friendly is what matters to people the most, purposeful living. I think that's incredibly important. So I'm just thinking if there is like a place where all these resources can be placed where we can access, because it might help sort of like we can leverage that information to make the best out of the work group. I'm not familiar with Care to Act and, you know, all that's happening in Montgomery County. So I'd love to know more.
Well, just FYI, the Time to Care Act is at the state level. But yeah, I mean, I'd be happy, Raya, to talk to you at any time we can think if there's anything that we're doing you need to know about.
Yeah, I mean, the age-friendly is mobility and purposeful living. So that's very helpful for our group. So perhaps Mark and I, we can just set a time where we can talk with you. I think that would be wonderful. Thank you.
Or I'll also suggest if you have any information, Sean, about that could summarize this, that I can share it with our group in our folder so that they have access to the information as well. I'll give you my email address.
And we have linked in our packet to the age-friendly domains, and there's a lot of resources available online. And then the other thing I wanted to mention is that I did send out within our last email a notification of an upcoming event that's all around sort of age-friendly ecosystems. And I encourage folks to join that and also to share that with members of their work group. That's coming up in October, a virtual summit over a few days.
Wonderful.
All right, Allison.
Thanks. I just have a kind of like a process question, and I apologize if this has already been talked about or if it's in one of the documents, but I know that there's an early November kind of deadline for the plan to be submitted. Can you share just a bit more about kind of what happens after that point? And what's the role of any of the work groups or this group after that November 15th, which that's crazy. That's like 6 weeks away, isn't it? So maybe 7. Just curious, kind of after that point, is there any role and work that you'll need from this group?
So our requested commitment is for this really concentrated period, which it is crazy. We were reflecting on, we're 25%, almost for some groups, almost 50% through their process. So it is just flying by. So the commitment from members of this group is really during this concentrated period to specifically develop the recommendations using the template that we have. And we'll talk through that. But again, that's really the start of this plan. So what we're hoping to continue to engage this group with is helping us to think through our implementation plan, helping to get the word out about this plan so that when the public comment period comes, we have everybody's perspective provided back, and we can make sure that the plan really does meet the needs and includes all the resources and opportunities that Maryland has to offer. Like Izzy was saying, what is unique about Maryland that's already in place? We can't know everything. So we're hoping to engage this group to help get the word out to our various groups. And one of the things that we're trying to do here as part of that strategy at the Department of Aging is, hold town halls. We also put together toolkits for people to be able to have their own kind of discussion sessions and then be able to collectively bring feedback back to us. And then, once we have a plan in place, it'll be active for a 10-year span. So that's when the work starts, right? And we're really focused right now on developing the plan. But part of that work at the department is what is the implementation plan? How are we going to do continuous stakeholder engagement? And anyone who receives our newsletter probably saw that we've got a member of our team that has moved over to help with the coordinating aspect of stakeholder engagement on an ongoing basis, which is so exciting because we now have sort of multiple roles focused on planning and stakeholder engagement, which isn't something we've historically had at the department. So we really will be continuing to work with this group, not bringing together people in a formal way on this ongoing basis, though if folks say, I want to continue to be part of it, I want to continue to meet on a regular basis, that can be part of our implementation plan. So we're interested in the feedback that this group has on that, maybe in meeting 4, right? As we're kind of getting to what we're trying to do, which is really create this plan. But I think it's a great question, and I think it's something we need to begin shifting our focus on as we get our recommendations in place. So we've kind of already shifted our conversation a little bit to our next part of the agenda, which is fantastic because we're keeping in time, which is really a discussion on the overlaps, gaps, and strategies to ensure progress, and really thinking about what resources might be needed for you guys in your discussions to be able to be successful. And I think we've already heard some examples of that. Any other thoughts that are kind of coming up as we're having this discussion? Go ahead, JJ.
Just an admin note for the live stream on YouTube. We had a Jackie Thomas reach out and just said they're interested in getting involved with some of the work groups. We posted a response to that to suggest they can go on to the aging.maryland.gov pages, and you'll find our planning page there for anybody also who intends to want to get involved and be part of these discussions. So.
Thank you. And also, yeah, keep listening in, Jackie and others, and give us your comments as you go. We are collecting those and bringing those in. That's part of our process here. Anything else? I'm really interested specifically in the resources. One of the conversations that we've kind of had is what are the best ways to frame these conversations? Are there sort of existing processes, frameworks, tools, questionnaires that members of this group have used in other settings to concentrate what can be a very huge and can be an overwhelming conversation into an effective, actionable discussion?
I'm really struggling with that, Liz. But, you know, because the 4 areas we're covering are so broad, it just occurred to me tonight while we're having this meeting that maybe a good starting point, and Tiffany, I'm relying on your guidance too on this, is to start with the housing department's last strategic plan thing that they did in 2020, because they did list out some strategic priorities, and it's the housing department. So that might be a place we could conceivably start at, but you know, I don't even know where to start with LTSS or affording healthcare. I mean, like, okay, I'm not sure that the health department has, but they might have a strategic plan or speaking to affordability of health, but I kind of think no is the answer.
Yeah, and I want to remind folks too, remember that part of the what comes next to Allison's question is also that once we have developed our recommendations using this template, we are doing a cabinet advisory group that's going to be reviewing the plan from the state perspective. And I think what would be helpful on that too is to be able to bring in those resources. Oh, we're working on it, and you might not have known that yet, to be able to make it actionable. So for example, you know, the state has just received an award to be part of the initial launch of the AHEAD model, which I can't remember what it stands for right now, but it's sort of the next stage of total cost of care. We know that has huge implications for how health is going to roll out moving forward. Yeah, so what's our role in kind of adding to that? Thoughts?
Izzy, I think so. I think Sean had touched on that already as well in our previous conversation. Sean, this is when we had our little one-on-one. Would it be possible to engage individuals from departments that are not currently participating in any of the work groups that we know from the different departments? So, for example, when we talk about affordable healthcare, can staff at MDOA do a little bit of legwork and help us find a little consultant and say, hey, we're going to ping you because our work group is considering working on this topic. A, do you have reports that are digestible that we can read? And B, do you have any opinions that can then fit into some of our work? So I don't think we should wait until the very end when we bring it to the cabinet level, because I think that the managers, the mid-level managers might have more of like hands-on information to help inform some of our decisions. So just if there's a way to getting, you know, each work group will identify the departments and the kind of managers or programs that we think we want to pick their brain for input, I think that would be immensely helpful and could save a whole lot of time, because we don't want to be perceived as out of contact with the realities. I mean, if our goal is to be multi-sectorial, we need to be able to be informed about the multi-sectors that we're going to talk about.
Absolutely. We can bring resources to that, and we're also already doing that, by the way. You know,
right?
we work with our partners. Yeah.
Right. I'll kind of talk about that, Liz. I'll take that. So absolutely, we need to do that. But we did an awful lot of that. Listen, it's a statewide thing, so you can't ever do enough. And Sean, my biggest comment on what you said, which is dead on, is we really need to make sure, not just Montgomery County, because we definitely have a nice Montgomery County presence in a lot of our work groups, but you know, the Western Shore, the Eastern Shore, not Western Shore, the Western part of Maryland, Eastern Shore, is very multi-state, right? But besides, we, you know, like within my group, you know, we purposely kind of sought out, if the people did not apply, we kind of did seek out. I mean, we knew we would need Department of Labor. We needed the Department of Disabilities. We needed the Department of Health. So, you know, we did do a lot of pre-leg work on trying to get people to come in at the beginning so that we had a lot of our departments somewhat represented, as much as we could. But, you know, I will say, I know I have, you know, within the family caregiver particular one, and Teresa is my sub chair, and she's on with me. You know, we have a lot of people who are going to be guests within that, who have been working on this, because there's a Maryland Commission on Caregiving that's been going on completely separate of this, and they're a lot of the experts. So we have, you know, they are invited to be with our subgroup. So we've sent out, you know, several kind of, you know, invitations, or, you know, we heard about you. I mean, I think even with Housing Village, you know, we can never get enough people talking about the villages, right? Because that's going to be a big one. So we did a lot of that to do the best we could, at least prior, to get a lot of these departments on all of our groups. So always can do better, though, always.
Yeah, and let us know when you feel like, oh, this is a specific question I have, this is some expertise we need, and we'll help organize that for these.
Or
groups.
Regional, the regional lack of presence, which is, I think, sometimes even harder than just the department, because we will make sure all the regions are recognized in all of these solutions too. They're different, much different from Somerset County to Montgomery County. So, you know, we need a nice broad regional presence for Maryland also, to make sure we're talking all on the same page.
Wonderful. Any last thoughts on here's what I need before we move over? And I'm going to take us through the template, because I think that's going to be something that we all need to get a real good sense of as we lead into our second and third meetings. And maybe too, here's what I have, if anyone is hearing things that they're bringing to the table and wants to make sure they're part of a specific conversation. Okay. Then let's shift. I'm gonna bring up our template. All right. Okay. So one of the big questions that we've gotten throughout this from folks that are joining is, you know, where do you want me to start writing? There's a lot of writing to be done here. You've got a whole plan. And that is something that we at the Department of Aging are bringing to the table, is helping to kind of bring together all the information we're hearing, all the information we're learning from our focus groups, from our other types of stakeholder engagement, where we're out in the community listening to what the needs of community members are. And all of the data that we have access to, right? We're going to be bringing that into place. And what we're asking our work groups to develop is really specifically recommendations that align with this template. So this template is linked in your work group packet, and this is what our work groups are tasked with. There we go, okay. So we're gonna go through it. And you'll see it's, I think the biggest challenge here will be bringing down these big conversations and all of the focus areas that we really feel passionate about, and bringing them into alignment in a concise way, because we're really keeping it concise. So each work group should provide 4 recommended objectives for their assigned goal, and each objective should identify up to 8 recommended strategies to help to reach that goal. And then answer the supporting questions, and we'll go through and talk about what those are. So using the packet that you have, as well as all the information you're bringing to the table and additional information that we can highlight for you, you'll be developing your recommendations. Again, we're using that SMARTY language, so that can really help us think. An objective needs to be specific, measurable, achievable, relevant, time-based, inclusive, and equitable. So as we're developing our recommendations, we're asking ourselves those questions. Is this measurable? Is this achievable? And that can be hard to know, right? So it might take some finessing as we go, especially from this group. Strategies may include enhancing or redesigning existing initiatives to improve collaboration, efficiency, and effectiveness, implementing systems change to build capacity of Maryland's public systems, the adoption of high-impact evidence-based programs and policies, and others. So we've already talked about some of those things here, right? For example, thinking about evidence-based programs and policies. It sounds like our Optimizing Health, Wellness, and Mobility group is already really thinking about that. What is going on in other states that we can bring to the table? And I think those are also places where we at the Department of Aging are bringing some information. So for example, enhancing and redesigning existing initiatives. The Department of Aging, in collaboration with other state agencies, is part of several technical assistance opportunities that are federally funded right now to understand what models are out there, and bring some of that knowledge and the expertise that the people that are leading those groups have into our work. And so we can also kind of highlight where we see opportunity for systems change from what we're learning. And that's why we're participating actively in these groups. Complete all areas of this template and upload to the file sharing platform by November 15th. So this effort should be led by the chair and the staff to figure out how best to design this, right? And there might be different processes that work for your groups. Who's going to be the person who's recording it? Is somebody going to take a stab at this and then ask everybody to provide feedback? Are you taking meetings to actually write together and wordsmith these recommendations? There's lots of different ways to do it that'll work for different groups, and that should be a topic of conversation within your work group. So we have some sample objectives and strategies in here that get at sort of the level that we're looking for. So here's some samples. So for example, potential objective: by 2030, increase the proportion of adults who report participate in physical activity or exercise by 5%. And then there's going to be a ton of strategies that could be used to focus on that might highlight a variety of different resources and a variety of different sectors that are involved. So we have, for example, by 2027, community-based organizations will work with older Marylanders to develop physical activity programming, policy, and promotion that incorporates pedestrian transit routes outlined in Maryland's Complete Streets Initiative. We're creating an example here that is cross-sector. Multiple types of organizations will need to be involved in a strategy like this, and it builds upon existing resources and strategic plans that are in place with the Maryland's Complete Streets Initiative. And then we have a couple of additional examples, and I ask you to please read through them. So here's what you're actually going to be writing, right? Your work group goal will be identified here. So when you'll submit it, we'll know who's bringing this to the table. Your recommended objectives. So based on the defined priority areas, the following objectives are recommended. You can see there's only 4 spaces here, right? You're going to have to consolidate, and that's 4 spaces per work group. And then we come down here and you've got your strategy. So we're asking you to write in your strategies and then identify, is it a short-term, a medium-term, or a long-term strategy? And then we have supporting information. So these are all the questions that we need to get to as part of this, right? So this is going to help to provide context. It might help as we're kind of refining these strategies to maybe see where there's information we might be able to bring into it to make it a little bit more specific and measurable. And it also provides us context so that when we're vetting and reviewing these strategies and objectives, we have more information to share with those who are doing the vetting. So how does the objective advance equity and inclusion? Please identify groups that may not be included in these strategies, and that might be something we want to take into consideration. What key partners are needed to accomplish these strategies? Those could be state partners, they could be private organizations or businesses, they could be nonprofits or philanthropy. What funding or resources will be needed to accomplish these strategies? One of the things that we just want to highlight is we all know that many of the strategies that we want to focus on involve significant financial implications. We need more funding resources. We also know that we don't have a huge influx of funding resources coming in. We hear that every time we hear from a federal partner. I've heard we're looking through the couch cushions example several times in the last couple of years, really trying to figure out this type of how can we work together strategically to align our resources. And so that's something we really want you to think about and focus on here. We know it'll take money and resources, but what's already there that we can also think about bringing together to leverage that. What legislation or policy changes may be needed. And this might be an area where folks really have questions. We've got a great legislative director here that can provide us some guidance and help us think through what policy is already here. We've got members of advocacy groups embedded in all of our work groups. So make sure we're asking that question and asking people to raise their hand and tell us what they know. What data could be used to measure the success of these strategies, really, and how can we work that into the actual objectives or strategy itself? And as I mentioned, maybe the data itself is a strategy. We don't have that data. We need to begin tracking something. How do we do that effectively? What existing programs or initiatives support these strategies? Are there already things in place at the Department of Aging, at the local level, at others, within other sectors? How do the strategies reflect the input and priorities of older Marylanders? And part of that is a question that the Department of Aging can bring to the table based on our stakeholder engagement that we're doing. And we also anticipate that all of you as members of local organizations and local communities are bringing to the table as well. So let us know that. And then include any additional suggestions or comments you have supporting this objective. So that's the structure. That's what we're asking you for. It's both a lot and I think challengingly concise. So what questions do you have about that to help you prepare to use this to structure meetings moving forward? Go ahead, Busy.
So can you scroll up? I'm just going to get some clarification. Each work group is responsible for putting forward further up, only 4 goals. So if, for example, we have 4
objectives. Remember, we already have
4 objectives. It says, okay, work group 1 goal and 4 objectives.
So we have all of our goals, our EPIC goals, are our work group topic areas. Support Marylanders to afford longevity.
In other words, we have 4 work groups, right? So we're going to have 4 different groups who are going to put forward this document. How many are we limited by our number of goals that we put forward?
Yes. So you have your work group goal is the work group that you're in, the topic area. The recommended objectives, you are selecting 4 objectives within your group.
So because this is important, that means that if we have 4 work groups, each one gets to have 1 objective.
I think that's the decision of the work group.
Just wanted to get clarification about the numbers here, that we're not like, okay.
Those are the right numbers. Now, whether that's how you want to identify it, I'm not sure. So for example, in affording longevity, are 2 of the work groups, are 2 of the objectives around housing and 2 of them around health aspects? Is the greatest impact opportunity actually looking at the healthcare system? Those are things that the work group's going to have to figure out how to evaluate and bring together. So we haven't said one of your objectives has to be around transportation, but it might be, right? Go ahead, Stephanie.
So I want to make sure I understand, because I thought I heard it differently, and then maybe I didn't. So what I thought I heard you say is that each work group has 1 goal. So there are 4 goals, 4 work groups, 1 goal per work group. And then underneath of that goal, there are 4 objectives per goal to be developed. So if you bring all 4 work groups together and our 4 goals together, then you have 16 objectives.
No, so Stephanie, I'll just so I'm in promoting economics. That is my goal. So that's it.
Right.
Goal's already up there.
I'm talking about objectives. Right.
Yeah, so promoting economics. And then I have 4 objectives under that.
Right, right. So
So
times
happens
4
that I'm
groups.
going to have 3 subgroups. So I suspect I'm going to have 3 goals from each, and one subgroup's going to get another. So the big goal has already been identified. And I would just kind of remind everyone, probably drop the word goal out of your vocabulary, because it is confusing. And I've had to say this a lot, Stephanie.
That's what I think is confusing.
Yeah.
But the 16 number comes from 4 goals times 4 objectives.
That is correct.
Okay. Just want to
You're
make
dead
sure.
on. Yep.
Okay.
You're dead on. So we've
Thank
already
you.
got our goals established. We're all going to come up with 4, and there's your 16. And then you got all these strategies. And I think something I'm going to be talking about a lot, and that we can all talk about, is and I know we talked about how in the heck are we going to come up with only 4.
Right.
I just feel if we talk it through, you're going to find out that some of those subgroups will come up with a strategy versus an objective. And you can find a way to put that strategy under an objective. I don't know, because my group hasn't done it yet, but we cross so much. And I think we'll find that some of our strategies are the same strategies that other of our goals, have. So I'm really hoping that I can properly talk through the strategy so that people don't get freaked out. How in the world are we going to come up with only 4 things? Well, it's just a plan, and it's just to start off. If we make this too big, we'll never get anything done. But the strategies is really where the rubber meets the road. So in my theory, that's how I'm hoping to kind of get people to breathe a little bit. It's okay. This is enough.
Right.
So.
And we want to include strategies for the objectives. Is there any limitation on, like, is there a recommended number of strategies? Like, you don't want to have 4
8 per
objectives.
objective, no more than 8 per an objective.
So
Right,
it's all specified within that template. So make sure to go back to it. Yang, go ahead.
Thank you, Liz. So for the 8 supporting information, is that per objective or per goal?
Oh, it's overall. So for each of your objective areas. So again, follow that template. You'll see objectives, strategies, and overall. That might be hard to do. If your strategies really are very unique, then you might want to give that supporting information per strategy. That's okay. That information is helpful to have.
Okay, thank you.
I want to point out we've got some good information in the chat. Allison will follow up with you on that. Any issues you guys are having accessing, please do contact us. Dan, thank you for the available resources, and we'll add them in. Raya, thank you for the goals versus objectives and strategies. I think we can take that information and put it into writing as well to share with everyone. So we're over a minute. I want to thank everyone very much for taking the time to join us today. We really appreciate it. Please feel free to follow up with your staff member, with your chair, if you have thoughts about how to take this information and organize your next meeting around it. These meetings are rolling, so you're probably already hearing about it. So, you've been identified as a member of leadership. Bring that leadership into your work groups. Thank you for being here, for listening, and for participating in the conversation, and we look forward to continuing to work with you. Have a good night.